Hi there, I'm Joan Sargeant, and I'd like to share with you an evidence-based four-stage model for facilitating reflective feedback and coaching for change. It's called the R2C2 model. This work is funded by an extensive research program, supported by an extensive research program funded by the Society for Academic CME, and currently funded by the Stemler Foundation of the National Board of Medical Examiners. As you can see, we're a pretty extensive research team representing a number of institutions and countries, and it's been a work that's been progressing for some time. The objectives of this short presentation is to identify the purpose of the R2C2 facilitated feedback model, and then briefly describe each of the four stages and provide some sample phrases for each. The purpose of the model is really to promote feedback use for performance improvement. Through study that we've learned, we need to encourage the learner to reflect on their performance and feedback. We need to seek their self-assessment and their perspectives and ideas. We need to promote their feedback acceptance, promote their self-direction for improvement, and of course guide and moderate this as needed. And we need to also coach for change to really help them to become the best that they can be. The four stages of the R2C2 model, as you can see in this demonstration, include rapport building, which extends all around and permeates all the other stages. It's the first R. The second R is exploring reactions of the learner to the feedback that they've received. The first C is exploring the content of this assessment and feedback they've received. And then finally, the second C is coaching for change. And I'll say a few words about each of these. Stage 1, looking at building rapport and relationships. And the goal here is to engage the resident, to build relationship, respect and trust, and understand their context. While many faculty have shared with us that they feel they know their residents, several have expressed that they haven't asked questions like this and that they found them helpful. So what have you enjoyed about the rotation? What challenges you? Tell me about your assessment and feedback experience. What's been helpful and what hasn't? Then how do you think you're doing? What are your strengths and opportunities? And what would you hope to get out of this session? Moving on from the rapport building, stage 2 is to explore reactions to and perceptions of the assessment data or report. The goal of this stage is really for the resident to feel understood and that his or her views are heard and respected. Questions that are helpful are, what were your initial reactions? Anything that's particularly striking? Did anything in the report surprise you? Tell me more about that. And this one in bold we find is really most compelling. How do these data compare with how you think you are doing? Any surprises there? And the goal really is to see if there are differences in how the learner sees him or herself and what the data presents. Because it's difficult to hear feedback that disconfirms how we see ourselves. And asking open questions in this manner can enable the learner to feel comfortable saying, yeah, I did have a surprise, or I was disappointed. And I really welcome the opportunity to talk about that. Stage 3 then moves on to exploring the content and the learner's understanding of the content, the first C. The goal is for the resident to be clear about what the assessment data mean for his or her practice and learning, and identify opportunities for change and development. Was there anything in the report that didn't make sense to you? Anything you're unclear about? Let's go through it section by section. Something that struck you as something to focus on. And that really is the intent of this third stage, is are there gaps or are there areas to focus on? And that really leads into the fourth stage, which is coaching for performance change. The goal here is for the resident to engage in developing an achievable learning and change plan. questions that help with this, with developing the plan, are what are one or two priorities for change, identified by this assessment data or suggested by this assessment data. Pick one of them. What would be your goal? What actions will you have to take? What resources might you need? What might get in the way of being successful? And do you really think it's achievable? As you can see, these questions all arise from a behavior change model. So once a gap is identified, then how can you, as the supervisor, coach the resident to really develop a plan and to be realistic about achieving that plan and making that change? In summary, the goal of the reflective feedback facilitation model is really, as you can see in the blue oval in the center, to transition the locus of control from external to internal. So if you look on the left-hand side, often we consider feedback as beyond our control. It's external. We lack control over it. It can be a threat. It can be emotional, about a bad me. And what the goal of the facilitated feedback model is to transition that locus of control to internal control. So the learner can think about it as, this is my data to use. It's my opportunity to use it for improvement. It gives me confidence. I'm in control. And the facilitator's role throughout this is to listen, accept, ask open-ended questions which stimulate reflection, and through this to motivate, and finally to coach, to help them use the data and to move on to develop a realistic plan for improvement so they can become the best that they can be. Additional resources for the R2C2 model are a trifold brochure, the Resident Learning Change Plan template, a list of general facilitation strategies, and please feel free to get in touch with me or any other member of the research team. I've provided a number of references. These ones are feedback references, the ones by Heen and Gawande. You may be familiar with. They really talk about coaching and help us begin to change our mental model from giving feedback to providing coaching to help our learners excel. The third one, which is in bold, is reports on the research done to date in developing the R2C2 model. Other references, these are references about learning and change, references about self-assessment, references about various approaches to reflection and learning and changing in residency. Some more on informed self-assessment, and that's the end of the presentation, and I hope you found it helpful.
So, good morning, Erin.
Good morning.
Good to see you again. This is our last 4-month review for this first year, and a chance for us to review your progress so far. Have you had the opportunity to review your portfolio?
I have. I reread them all last night.
Okay. And before we start our discussion, I'm curious about how the last 4 months have been for you. What did you enjoy, and were there any challenges?
I found my last 4 months were a bit rough, actually, especially my internal medicine rotation. It felt like I never had the answers to the questions my preceptors asked, and I became a little overwhelmed with how complicated my patients were. And they just seemed to be in hospital for so long that I wasn't sure of what I had to add to their care plan. My other rotations, though, seemed to go okay, including my family medicine rotation.
Okay. So it's pretty understandable you'll feel challenged on internal medicine. I think a lot of us would feel challenged on internal. It's a busy rotation with a lot of patients. Before we discuss your progress, I'd like to hear how you feel our previous sessions have gone.
I found them quite helpful. I like gaining just kind of that broader perspective on how I'm doing in general. I've also enjoyed getting a detailed plan on some of the specific issues I'm having, so that's been really useful. Honestly, I was a little nervous about today, just because I have felt like my last 4 months have been a bit rough. Again, it just felt like the hospital was so busy. We felt like we were short-staffed with a resident, and I just had a lot of difficulty keeping up.
Okay. I can understand feeling a bit unsettled, but my job is to address your concerns and to plan for improvement. So let's get going on that today. Do you have any specific expectations for this session?
I think just getting some specific recommendations on how to improve my performance is what I would like to get out of the session.
Okay. That sounds very aligned with what I was hoping we would do today too. So let's get started. When you reviewed your e-portfolio in preparation, what was your first reaction to the feedback?
I was surprised that I was seen as my communication as being weak, including that my handovers weren't sufficient. I really do try to work hard at keeping everything, I guess, sufficient to take care of my patients, so that was a bit surprising.
Okay, so we definitely need to discuss communication and handover. I know it can be difficult to hear feedback that doesn't quite fit with your own view of yourself and how you're doing. Was there any other feedback that surprised you and didn't kind of quite fit with how you thought of yourself?
Yeah, there was a comment about needing to improve on formulating my differential diagnoses. That was a bit surprising to me, as it hadn't come up during the rotation, so
okay.
that was a bit surprising.
So it seems we've identified two issues that we can explore today and figure out together what might be the best path to help you approach those better.
I think that sounds good.
Before we go on any further, was there anything in the report that was particularly pleasing?
I liked getting the recognition that my knowledge base and clinical skills were solid, as well as my dedication to reading around my patients. I really do try to provide the best care I can, so it was nice to see that was recognized.
Great. So that was reassuring, I'm sure.
Mm-hmm.
So let's look at your e-portfolio and the comments that were provided by your rotation preceptors to see what we need to focus on today. How would you like to start?
Well, I seem to be struggling with this EPA, the managed care of patients with acute common diseases across multiple care settings.
Okay, what catches your attention about the feedback you received on this EPA? How do you understand it?
I found it a bit hurtful, the comments about not completing my notes, as I really do feel that I'm staying late quite often trying to complete them.
Okay. I can understand it might be hurtful. However, in my review of your portfolio, it was flagged by more than one person in your communications milestones that they were concerned that other team members did not have enough information to care for patients when they'd subsequently assumed care. For example, on several of your workplace assessments that were completed during internal medicine, it was noted that your discharge summaries weren't completed. I also noted that during your emergency medicine rotation, some of the preceptors commented that you hadn't documented your reassessments and that some referrals hadn't been completed. I'm wondering what they're seeing that is difficult for you to see.
Yeah, I mean, there might have been a couple times when I thought patients weren't that complicated and I had to be somewhere quickly after work. Maybe during that time I didn't review my chart notes as closely as I would have liked. It seems like during the day I really am struggling to keep up with all my charting and taking care of patients, but it does seem like I'm always the last one to leave the office. So I'm just struggling on getting everything done.
So I wonder if there's a connection between the time management challenges that you're having and the perception that you're not communicating well. How do you make sense of that?
I'm not sure. I do know that when I get stressed, I do tend to make shortcuts to try to get everything done. So that could be a part of it.
That might be part of what's going on. Looking at the report and building on what you've already identified, that people don't feel you're communicating effectively, as you need to in this kind of multidisciplinary environment. I'm wondering if it's been difficult for you to ask for help and to figure out the time management issues. What do you think?
I think so. I pride myself on my foundation of knowledge and my clinical skills, but sometimes I feel that my preceptors think that I should be able to take care of my patients and my clinical duties on my own at this point, so that makes it difficult to ask for help.
I wonder if I can challenge that assumption. I don't think this is something that we've specifically addressed before. I certainly don't expect you to have all the answers in this day and age when there's such a vast overflow of knowledge. It's much more important that you really acquire the skills to learn at work and to ask for help when you need it from members of the team. You might be surprised by how receptive staff were for your requests for suggestions and how to manage your time more effectively.
Yeah, that's something I've never thought about doing before.
Okay. So looking at your Foundations of Discipline EPAs, it looks like you've done an excellent job of getting a variety of workplace assessments for your EPAs. It looks like all your EPAs but one seem to be consistently assessed as completed. So that's pretty fantastic. You've got to feel good about that. It looks like just the one EPA, the one that you mentioned, managed care of patients with acute common diseases across multiple care settings, that we still need to work towards achieving. When we dive deeper into the EPA and look at the milestones, it looks like the communication milestones seem to be where you're struggling. Based on what we've discussed, let's try to set a clear goal and a change strategy to address that goal to help you achieve that EPA. What would you like to work on?
I think I would like to work on my time management then.
Okay, that sounds like an important issue that may indirectly address some of the other issues as well. Let's take a look at the learning change plan together. What changes might you make that would help improve your time management skills?
I think I could start by asking other residents and my attendings on my rotation tips on how they seem to manage their workload and learn from them. Also maybe making a to-do list, something that at the end of the day I could look over and make sure that I've completed all the tasks I need to for that day.
Okay, that sounds like a sensible plan. I'm wondering how you'll know if any of the changes you've made are making a difference.
I think I could do that by asking other residents and attendings if the discharge summaries and my chart notes have been useful for them in taking care of my patients in a satisfactory way. I think hopefully by doing that early on in the rotation I can get some good feedback.
So that makes sense. Let's write down each of these ideas in your learning change plan. It asks us what resources you think you might need to complete this change.
I think the resources I would need would be the cooperation of the other residents and some of the attendings. I know they're quite busy, so it could be difficult, and so it might be a good idea of approaching them early. I think on top of that, maybe making some reminders in my phone to ask for help could be useful.
Mm-hmm. I'd probably forget to if I didn't remind myself. Your plan sounds solid. How will you know if the desired results have been achieved?
I think by getting that regular feedback that we talked about, hopefully will give me an idea if I'm meeting expectations. I think I'm hoping that by doing this, I can improve my performance, and hopefully my preceptors at that point will feel that I'm meeting my requirements for the EPA.
Great. Let's just make sure we capture all of that on the change plan. Remember, every resident is going to achieve the various EPAs at different rates, and this time you're doing well and you're still within the normal range that we would expect for achieving this last EPA at your stage of training. I'm hopeful that by completing the learning change plan, it'll help you make the changes that be needed to achieve this last EPA and over the next few months. Let's move on then to another goal that we can look at today.